Evening televiewers, you're welcome to this very last edition of Prime Hour for this week, the Friday, the 7th of October 2022. This evening, like I announced on our respective social media handles, that we are going to be looking at something away from politics, titled Understanding and Arresting Spiritually Induced Neuro-pshychiatric Disorder, known as mental disorder or madness. This evening we're going to be looking at issues of witchcraft and magic, how these things work, with a medical doctor who before 2016 never believed in anything as witchcraft or magic. He believed that all that mattered was supposed to be evidence based on what science actually says, but faced with a situation, especially touching on her daughter, and he was forced to look beyond the physical. So in that process, he got to discover extra powers that were embedded and living in him. Dr. Soliman is handling medical or health programs on my Media Prime. When I got to find out that he had these powers to go beyond what is physical, I pleaded with him to come this evening on Prime Hour and share with us all where his source of powers are coming from, what he has lived, but focusing on the source of most of these mental disorders that we are living with. We have brothers and sisters, parents who are not mentally stable. According to a doctor, most of these disorders are spiritually induced. He's going to be telling us where they are coming from. Doctor, we're glad to have you once again on Prime Hour.
Thank you very much. I'm glad to be here. How are you, Mr. Leo?
No, I'm doing good. We know that when we hear of Dr. Soliman, we hear of, what comes to our mind is Soliman Clinic.
Yes.
That operates in Boya and in Douala.
Correct.
But today we're going to still be talking about that, but going beyond that. And we are looking at neuropsychiatric disorder in human beings, brothers and sisters. What are we talking about when we talk about neuropsychiatric disorder?
Well, neuropsychiatric disorder, it's a disease that touches the nervous system,
okay,
or touch the brain and the behavior that is very much coming from the brain and the brain chemicals and neurotransmitters.
Mm-hmm.
So when we talk about mental disease or neurological, some of the neurological diseases, we're basically talking about a true neurological disease or a true mental disease that is, coming from imbalance of chemicals inside the body, or because of a medical condition like a foci, like a calcification inside the brain or whatever. So something that is true, something that we can test, do an imaging study and find. Something that we can do an EEG of the brain and we find evidence. So we can say, based on this evidence, this patient has this mental disease, or this patient has this neurological disease. This is what we call evidence-based medicine. But come to discover and realize that not all neurological and mental diseases are caused by something medical.
Mm-hmm.
It could be caused by something that is spiritual.
Okay, and that is the focus for our discussion today. What is spiritually induced neuropsychiatric disorder?
Well, let's take a small example and that will explain it all.
Okay.
If we have somebody with malaria, this malaria is not treated for a while. It goes to the brain. So we have now cerebral malaria, malaria that has affected the brain.
Mm-hmm.
When malaria affects the brain, the patient will hallucinate, will say things. You look at the patient and you say, this patient is mad. He will also do some movement that does not qualify for a normal patient. This is something that you will see. You look at this patient and it is just cerebral malaria that has manifested neurologically. So this is what I said. This is a neurological disorder there that is caused by malaria. So I treat that with anti-malarial medication. But I can have the same exact behavior, the same exact hallucination, and I give them malaria treatment. It doesn't work. I give them every medication that's in the medical book, and it does not work. I give them everything based on clinical diagnosis, but it doesn't work. This is what we're talking about, spiritually induced. Because if you have a medical condition based on a medical cause, that's a medical condition induced by a medical cause. But if we have a medical condition not caused by a medical cause, that is spiritually induced. And there are evidence, and we'll document this in this session. We will document and we'll talk about this in this session. And you know, I highly recommend that this session to be 18 and plus, because we will see some disturbing videos to some. So I wouldn't recommend children to be around.
Okay, very disturbing. I hope that we are getting this. You say spiritually induced, not caused by a medical condition.
Yes.
Which means that it is coming from somewhere. Where could this be coming from?
Well, this is what we're talking about, is spiritually induced. Like we know, our body is not just body. It's not physical body only.
Okay.
It is also a spirit. And like the body gets sick, the spirit also could be affected and get very sick. And when the spirit gets very sick, that will reflect on our body. So we can have manifestation, physical manifestation, because of a sick spirit.
Okay.
How the spirit gets sick, that would be, I think, you know, a very logical question to ask. How would the spirit get sick? Normally, the spirit doesn't get sick unless somebody has targeted that spirit with some witchcraft or black magic that they do. And in this case, the spirit will get sick and it will manifest with a neurological or a mental disorder.
Okay.
And sometimes many other ways. It depends on how the magician or how the witch programmed the witchcraft to work. It's just like a computer program. How they program it to work, that is exactly how it will manifest in the victim. That is exactly how it will manifest in the victim.
Okay. You are a medical doctor.
Yes.
We have been receiving you here on our TV, talk about medical issues. But today, you are talking spirituality.
Yes.
And I know that before 2015-16, you did not believe in some of these things. How did you get involved?
Well, in 2016, I have a session on CRTV, and I was asked, "Doctor, what do you think about mental disease, you know, and witchcraft?" I said, "I do not believe in witchcraft. It's all delusion and hallucination." That's what I said back then. A couple of years later, I had an incident in my family. And it was a child, 10 years old at the time. And it was very horrible. The child will fall. It started with just the child falling. The child had difficulty in breathing. I take the child to the clinic. The oxygen saturation is very good. The child is breathing fine. Yet, she falls. That's the beginning. That was the beginning. So I thought of epilepsy. And that's my specialty. I consulted with colleagues overseas. Everybody got their own diagnosis. A couple of months later, the condition worsened to be very bad. That the girl now will tremor. I will not share the video with the audience, but the girl will tremor like epilepsy. But the funny thing is, it is not epilepsy. Epilepsy lasts for a minute, 2, 3, and when the whole body shaking, we call it status epilepticus, and we treat with one injection called diazepam or whatever you have, lorazepam or whatever you have there, doctors knows, and the situation will recover.
Okay.
But in her condition, she will not recover. She will tremor for hours. To the last stage, I have to put her on medication called phenobarb to induce coma on my child so she does not tremor. I stayed CT scan, MRI, LP puncture, add medication, take away medication, do this, do that, nothing. The condition will only getting worse. Till I finally realized that somebody has recommended to my wife that it's witchcraft. I said, what witchcraft? I don't believe in witchcraft. And then with the days passing, I'm going to tell you one thing that you will really, shed tears if I tell you. One day that girl was tremoring too much that the tremors will not stop. I give her medication to put her to sleep. The minute the medication effect wears off, the girl is back tremoring. So I contact my colleagues, what is going on? I give up. I don't know what to do anymore. They said, because they are specialists, this is epilepsy specialist that does nothing else in medicine except epilepsy. He said, no, you have to take that child to the closest hospital that has mechanical ventilation. Where I am, there is no mechanical ventilation. I have to bring her to Yaoundé for mechanical ventilation. Because when she tremors so much, all her muscles are stiffing and contracting, and we know the respiratory muscle here, the diaphragm, is a muscle. So it can also contract and become stiff, and the child wouldn't be able to breathe, and that's death. So I took her with the ambulance, and every 4 hours, the drug will wear off. I have a nurse in the back. Doc, she starts to move, so I have to stop the car, go and give her an IV, put her back to sleep. The trip continues for hours, and then I get to the hospital, and they measure the oxygen. The oxygen is fine. My house was oxygen tanks. The ambulance is oxygen tanks. The clinic is oxygen tanks. It's nothing but oxygen. We live in a clinic because of the child. So finally, we get to Yaoundé, and guess what? The child doesn't go to epilepticus. I mean, it looks like epilepticus, the whole body tremoring and shaking, but it is not epilepsy. This is after we exhausted all means of medication. Every medication that exists for epilepsy we have given. And the situation is only getting worse. So the child told me, and I remember that, Baba, just take me home. I want to die home. She will sleep with me, eat with me, go to the bathroom with me, everything, 24 hours, 7 days a week. She is attached to me, on diapers. Anyway, situation was very sad. To go back, and my wife has a neighbor, and the neighbor told her, listen, this is witchcraft. I said, what? Witchcraft, yes, witchcraft. So I did some research, and I found out the best man to solve the situation. We flew him in. And after the first session, the girl recovers. And that was it. From that moment on, that man, I really thank him very much, him and his team, had discovered that I have powers that I don't even know exist. And I don't discuss that with anybody. I just use my powers to treat patients that went through the same hell without any means of resolution. Medical will not work for spiritual. That is what I have discovered. And I'm now fully convinced, based on my own experience, that this is a reality and we have to deal with it. To summarize the story, my house help was behind it in collaboration with somebody called himself Prophet that do this kind of things at night. And the whole target was, give us money, we recover the girl.
Okay, so the house girl was behind what was happening to you and working with a prophet.
Yeah, what somebody called himself Prophet, a young man.
Were you taking the child there? And
absolutely not.
Okay, you never took.
I never believed in this.
Yes, but no, when
the whole thing was extortion.
You brought somebody from where? From Tunisia?
Yes, he's a Frenchman, but originally Tunisian.
he's the one who told you that this is spiritual.
Of course. He can see.
Okay.
He can see the whole thing. He can see who's done it. He can see the whole story behind it. He can see the whole thing. And that's what, the first session, the girl, that's it.
Now, when he came, he told, where was this coming from?
What country he's coming from?
No, what actually attacked your daughter was spiritual.
Yes, was
So
spiritual.
he saw the source?
Yes,
And
he
where was
saw the source, that it was black magic done. I'll explain to you in details how it happens.
Okay.
Every human being is shielded with a shield, electromagnetic shield. That shield is to protect us from those entities, so they cannot penetrate unless the shield is broken. So the function of those switches is to break the shield and invite those entities to your own body, and they take control of your spirit. And your body is not used to so many spirits at the same time. So you misbehave, you tremble, you manifest according to how the program was put by this witch. She wanted you to be sick, you will be sick. She wanted you to die, you will die. She wanted you to have a mental condition and act crazy, you will be. Is according to how she programmed the magic. And that's exactly how it will happen. But it only happened after breaking the shield that protects us from them. So they see us, we do not see them. And that is their major power, that they are invisible to us, except for those some people, very few people in the world, that are gifted and they can see.
Now, where did this come from to attack? You say it's black magic.
Yes.
Who did it to your daughter? Did he see the person?
Yes.
Okay.
And the person confessed. We know.
The person?
Both of them confess.
The person is in Cameroon, in Boya. They live around you?
Yes, they, at that time. Now I don't know where they are.
They were living with you in the house?
The house help was with me till this finally happened. She left when my daughter was sick. She was around and she was enjoying her work. Look, this is my work. I come with my daughter, carrying my daughter sick. Ashia, daddy. You understand what I'm saying? So she was like enjoying the work. The next step would be, give me money and I make it all go away. That was the target. Give us money and we'll make it all go away.
Give us money. Who? The house help? Was she a spiritual somebody?
She is now advising that I know somebody who can help. For
money?
Yes.
And this person is another witch doctor or a man of God?
This is the prophet, the man of God.
Okay.
But listen, this is not a real man of God now. This is a fake man of
fake
God.
man
Because
of
there
God.
are real, good, nice men of God. But this is not. This was all about money. It's all about extortion and money and inflicting harm in people so they can give in and do whatever he wants.
Okay. Now, when this man came in from Tunisia, he had the first session with your daughter. She got well?
She got very well.
And now, how did you now develop this, I don't know, these powers in you? And seemingly your wife also.
We always had it. We just didn't know that we have it. It has only been discovered that we have this kind of powers after the man has told us, listen, you can do it. You are better than me. You can do exactly the same thing and you can kill. I see that you have exactly what I have. And with my wife, yes, he told her you can see, and she actually can see. She could see everything that is going on with my daughter. We just didn't know. Maybe this happened to us, so we can know that we can.
You have powers.
Yes, and we can help others that has been through the same scenario. Having gone through what I have gone through, I would never know what people go through.
No, he just told you that you have these powers.
Yes.
But now, what happened for you to start using these powers?
When I see patients that are coming, similar scenario, they've been to so many different clinics and different hospitals, and they have the same disease, has not gone away. Most of us psychiatrists treat madness and mental issues with chemicals, with drugs. Sometimes it doesn't work. The patient has to be in medication for the rest of their life. And you, like I said in the beginning, you cannot treat what is spiritual medically. You understand? You cannot. It will not work. Just like the story I've said.
Okay.
It wouldn't work.
Now, let's look at a session of Dr. Soliman. He actually advised that if you are less than 18 years,
Yeah,
you should not watch.
Please, yes. No children should watch.
Okay, children you should not watch this. Let us watch a session of Dr. Soliman and a patient. What was she suffering from?
This patient in the edge of madness. She's been for years sick of this issue.
She's mad?
Attacks. Sexual attacks. Her life is all blocked. She's an educated, very educated girl. She finished university. She's and things are not going. She is going crazy, and nobody believes what she's going through. Sexual attack very much every night. She sees them, she hears them, and nobody believes what are you talking about? We don't see anything. She sees them and she hears them all the times. Let's watch and see.
Okay, let's have the first video of Dr. Soliman, please.
أعوذ بالله السميع العليم من الشيطان الرجيم بسم الله الرحمن الرحيم وكان حقا علينا نصر المؤمنين 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 فطاف عليها طائف من ربك وهم نائمون فأصبحت كالصريم فطاف عليها أعوذ بالله السميع العليم من الشيطان الرجيم أينما تكونوا يأتي بكم الله جميعا يأتي بكم الله جميعا يأتي بكم الله جميعا يأتي بكم الله يأتي بكم الله جميعا إن الله على كل شيء قدير أينما تكونوا يأتي بكم الله جميعا يأتي بكم الله جميعا يأتي بكم الله 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 جميعا أينما تكونوا يأتي بكم الله جميعا فقاتل أولياء الشيطان فقاتل أولياء الشيطان فقاتل أولياء الشيطان كان ضعيف وقاتل أولياء الشيطان فقاتل أولياء الشيطان إن كيد الشيطان كان ضعيف فقاتل أولياء الشيطان فقاتل أولياء الشيطان إن كيد الشيطان كان ضعيف أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم نور أينما تكونوا يأتي بكم الله جميعا يأتي بكم الله جميعا يأتي بكم الله أينما تكونوا يأتي بكم الله جميعا يأتي بكم الله أينما تكونوا يأتي بكم الله جميعا إن الله على كل شيء أينما تكونوا يأتي بكم الله جميعا يأتي بكم الله جميعا يأتي بكم الله 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 جميعا إن الله على كل شيء قدير أينما تكونوا يأتي بكم الله جميعا يأتي بكم الله جميعا إن الله على كل شيء قدير أينما تكونوا يأتي بكم الله أينما تقول يأتي بكم الله جميعا يأتي بكم الله وقدمنا إلى ما عملوا من عمل فجعلناه هباء منثورا هباء منثورا هباء منثورا. Look at the light. الله نور السماوات والأرض. Look at the light. الله نور السماوات والأرض. الله نور السماوات والأرض. الله نور. الله نور السماوات والأرض. الله نور. الله نور السماوات والأرض. الله نور. حرمت عليكم الميتة والدم ولحم الخنزير وما أهل لغير الله. حرمت عليكم الميتة والدم ولحم الخنزير وما أهل لغير الله. حرمت عليكم الميتة والدم ولحم الخنزير وما أهل لغير الله. حرمت عليكم الميتة والدم ولحم الخنزير وما أهل لغير الله. حرمت عليكم الميتة والدم ولحم الخنزير وما أهل لغير الله. حرمت عليكم الميتة والدم ولحم.
Okay, Dr. Soliman, not really easy to watch and withstand. What were you struggling to do there?
Okay, let me explain to you what is going on there. You see the patient with the mask on. That is the patient that is suffering of hallucination. We call it a medicine hallucination. She sees what you and I don't see. And she hears what you and I don't hear. And on the top of that, she gets attacked by this giant entity, sexually, very much every night. So she's been to places, she's been there, she's been here for the last 4 years or so, and nothing works. She's been to deliverance sessions, nothing works. She leaves the place, she gets attacked. So she finally came to us. I don't advertise this very much, I don't. This is something that when I see a patient that needs help, then we will do the sessions and work with the patient. Now, what you see here, let me explain to you what's going on there. This is the patient with the mask. She has, she's possessed, she's highly possessed. A lot of those entities are inside of her. They've been there for a long time. And this is what one of those sessions, when we extracted this entity, the big one, the most evil one, The whole plan was leave all of them alone, just pick up the biggest, the chief of them. And this is who I grabbed. When I grab him, then I prison him in my wife's body.
Okay. That was your wife? Yeah?
Yeah.
Okay.
So I grabbed him and I put him in her body. And he doesn't know what hit them. He doesn't even know where he is. See, they rely on speed. Those entities, they are like waves. They have no shape and they have no weight. They are like waves. So their major force is what? Speed. They are very fast, like waves. So when you hit your body, you tremble. Like you see, she trembles because this is when I bring them in. After I bring him in, is the power of God, is not my power. Is the power of God. I offer him, accept the light. If he accept the light, you are free to go. He accepted the light, finally, after he seen death, Allah will kill a lot of them. He accepted the light, but I said, okay, you can go. He said, this is my home. I live here, I live in her body. I said, you can no longer live there. You have to find somewhere else to live. I find you tomorrow, I kill you. So the power of killing is actually from God. And there is only two categories here. There is the dark and there is the light. You illuminate like light, you are free to go. That means you accepted God's lights. You accepted God. You go. You don't accept, you stay dark, then you die.
Now, doctor, this lady, you say many of those spirits were living in
This
her.
is exorcism, Mr. Leo.
Okay.
You know, this is exorcism. She is highly possessed with all of those entities. So what we do is take them all out of her body, put them in my host body, and then deal with them. That is basically it. Very simple.
What were you reciting?
This is from the Quran, the holy book of Quran. We do not deal with them. We do not make deals with them. We do not ask for sacrifice. Anybody who asks for sacrifice, get me a cow, get me a fowl, that's a magician there. It's only God and his power versus the dark forces. That is as simple as it is.
This lady in question, has she been delivered?
Yes, by somebody in Boya, but
Okay.
it didn't work.
Yes, but after the session?
Yes, she's fine.
She's fine?
We had done 2 sessions so far. She still have about maybe 2, 3, 4 sessions and she'll be fine.
Okay. So when somebody has a mental issue and maybe the family does not know where it is coming from, they contact you, or you
Yes.
just identify them?
The common complaint, most of them don't accept treatment. They will not like to see doctors. They are seeing things. Their behavior has changed. They are talking to themselves, because it's not like they're talking to themselves because they like talking to themselves. They are talking to themselves because they are hearing those entities talking to them. So in return, they talk back to them. So when the family come and say they are talking to themselves, not really. They're not talking to themselves. They're just talking to entities that they can see, but you cannot see. So that is how this is the most common complaint. Doc, she's talking to herself.
So I want to understand better how you develop the powers in you. You say 2016 you did not believe in witchcraft.
No.
Now somebody comes from Tunisia,
Yes.
treats your daughter,
Yes.
and now says you have the power.
Yes.
He told you to start reciting the
Yes.
Quran, or how did you?
Specific verses of the Quran. Let's say I need fire. Let's say when I work with my wife, she sees something that requires fire that to be burned. Like she see the magic. She sees the symbols of the magic in front of her. She wants fire to burn it. Then I'll offer her words of God that has fire, and when I say fire, when I recite and it says fire, I say it as words. This words is transmitted as action. When I say fire, they're already in fire. When I say water, they're already in water. When I say God, they already see God. When I say the light of God, they already see the light of God. So whatever comes out of my mouth is reality to them. When I say you're gonna be punished, I'm gonna, let's say, fry you on fire, they already feel the fire. It's not that they feel it; it's already there. You see? So what I say in words, it's actually transmitted to reality in their word. In our word, it's just saying, but in their word is action.
Hello, Mr. Liu. I'm Pankeng Yafe in Bangul, and thanks for your kind educative program. Your panelists have been so wonderful. Greetings to Dr. Soliman. Okay, thank you too. Good evening, Mr. Liu. Very educative program. Please, I just want to find out from the doctor, how can he handle drugs addiction? Can he also handle it spiritually? I'm Ruben, writing from Limbe.
Well, I get a lot of drug addiction, and believe it or not, most of it is spiritual.
Okay.
Most of those drug addictions spiritual. Normally, drug in medical definition, I smoke something, hallucinogen or cocaine or heroin, to a point that my body gets so used to it. This is how we explain it medically. My body gets used to it, and it can no longer function without this substance. That's what we call substance abuse and then substance addiction. But the reality of it, in some of those patients, when we do sessions, especially psychotherapy, we find that there is actually an entity that wants him to smoke, and sometimes the entity is living with him or around him or inside of him, and that is the one that whisper in his head, it's time to take a joint, or it's time to shoot, or it's time to sniff, it's time to lose your mind. Because that's what it is. It's about losing your mind. Whether it's alcohol, that is the most commonly abused substance, most of them, they have some spiritual element that push them and whisper. It's like they do not make you do things, but they tell you repetitively that, okay, this is what you have to do. Do you want to feel good? It's like an anxiety, repetitive thoughts. Those repetitive thoughts are coming from them. And then you follow by action. You go and smoke. That is the action. So repetitive thought followed by action, your anxiety comes down, and now you relax. You're not anxious anymore because you smoked, or because you drank, or because you shot an IV heroin or something, or sniffed cocaine. Now, so it's all start with what? Those addictions start with what? Thought that has been repeated in your head 1,000,000 times, and in order for you to stop this repeated thoughts in your head, you go and do it. And this is now you feel calm now.
Okay. And have you had persons delivered from this who were addicted to it?
Yes, just recently, yes. After 1 month treatment. But then again, 1 month treatment, we always recommend you have to come for a follow-up, weekly follow-up, then bi-weekly follow-up, then monthly follow-up.
Now, these spiritual sessions, when you engage them, you say there is no sacrifice that are done to get them delivered?
No, we cannot. Because we are working with the powers of God. If somebody asks you, you have to sacrifice a chicken or sacrifice an animal, he is not working, or she is not working with God. God does not require sacrifice. You say, it doesn't matter what religion you are, really. Evil has no religion. So it doesn't really matter whether you are close to God, you are Christian, you are a Muslim, or any other religion. I have another video that is a white lady there. So that means, witchcraft exists even in Europe. Everywhere it exists. And it has a manifestation, and it has negative impact on the patient or the victim. And you suffer from it, and you don't know what to do or where to go, because it is not medical. And it's solved only by one means. And my advice is, like I have said, there is only two kinds of entities in this world in general. We have the light, we have the dark. And those two forces are always
conflicting.
Yes. So if you're suffering from a spiritual problem, and you go to somebody and tell you have to sacrifice, you run away. Because he's going to use dark forces against the dark forces that you already have. Which one wins? That is the outcome. He didn't eliminate, because they are ranks. Those entities, those evil, they are ranks. They are the strongest, the less strong, up to Satan himself. So they are ranks. Whoever is higher rank can kill the lower rank. So if I go to a magician to cure me, and his forces that he deals with are lower rank than my forces that I have in my body, my mind will kill him. Will kill him personally also. That's how powerful it is. When you rely on forces other than God, you suffer. Even if you rely on the light ones, the ones that believe in God, you cannot rely on those either. Because you do not know if they change their mind the next day and they become dark.
Okay. Good evening, Mr. Leo. What a wonderful topic today. I want to find out from Doctor if he believes in men of God who do healing. Thanks. Mullah Nango is writing from Limbe. Is going to, so I'm sure, say a word on that. Good evening, Mr. Leo, and thank you for the great job you have been doing. Please, where is the doctor located? George Ngwa is writing from Bafut. Dr. Soliman, where are you? You are in Douala and in Boya?
Douala and Boya. Yes,
Okay.
Douala and Boya. In Boya, I'm at mile 18 junction. You see a big signboard there that says Dr. Soliman Clinic. In Douala, I'm in Bonaberi at Antre Belot. And you'll see also this, the signboard there. And my number is 694-94-0172.
Okay. So we have in Boya, mile 18.
Mile 18 junction.
Mile 18, that is after mile 17.
Yes, correct.
You have him there. And in Douala, you have at Bonaberi, Entre
Yes.
Pilot. So he has given his number, but if you want, you are living with persons who have spiritual problems, but just any spiritual problem, you can face them?
Yes, with the power of God, we can. Anything, even if Satan himself and inflict pain and suffering on somebody, like I have seen with my own daughter, I will kill him with the power of God, not with my power. I'm nothing, really.
Now, doctor, when you do this and you say you do it with your wife, you people see all these evil creatures,
Yes.
entities, and you are not scared?
I do not see.
Okay.
I feel their presence. Once I call for them, I know they're there. I feel them. My wife, and there is other people also that have that gift. They see like I see you.
Mm-hmm.
So, for example, we had a session recently, and she was trembling, she was scared. I'm scared. I said, no, don't be scared, because you're scared, you get hurt. So the whole thing, she said, if you see them, you'll be scared too. I said, you're right, maybe I will be scared. But if I get scared, then the whole
Did she
thing can
describe
flip.
how they look?
Yes, big horn coming to swallow her. Big satans with horn, big ones. That is the head size is like a size of a human being. Can you open your eyes and you see those things coming to swallow you? You'll be scared. But it's just that we have the power of God with us. And this is exactly a session that we had yesterday, I think yesterday. And I killed them, alhamdulillah. I killed them. 5 seconds, flat, finish.
Okay.
Yeah.
So, Doctor is in Boya and in Douala. Good, very interesting one there, Mr. Leo and Dr. Soliman. Please, can the doctor clarify me the difference between dark forces and black magic? Looney Joel watching from Yaoundé.
Yes, very good question, very good question. See, the dark forces are what the magician use to deliver the magic. Meaning what? For example, I give you something to eat that has something.
Mm-hmm.
I spray something in front of your house, in front of your gate. When you stab on it, that's it, the magic sticks. So the magic is something physical.
Mm-hmm.
The entities are something that is not physical. They are entities, they are like waves, they are like
forces.
energies,
Mm-hmm.
negative energies. They are entities, but you cannot touch them, you cannot catch them, because they are made of very light material. They're made of fire. So they are not dense like us, we're made of mud. So they are very light. So now the magician did something physical, deliver it to the victim by any means, And now those entities, the dark forces, is to secure this physical magic because it's nothing but writing and drawing and some crazy stuff that they make. The entities is to make sure what is written in that is to be delivered and affect the victim.
Okay.
So they are guards, and they're making sure to deliver everything that is written in that physical piece of paper or whatever to be delivered to the victim. That is their job. Without them, the magic will not take place. You see? And without the magic, they have no function. And most of the times, they are enslaved to do such a job. Most of the times, they do not like it. Those magicians will threaten them with their wives, because they have wives and kids just like us. They'll threaten them with their wives, with their kids. If you don't do it, we kill your wife. So they are enslaved by dark powers to do this dirty job. And if you think about it, at the end of the day, who is responsible for such a horrible thing? Human Not beings. Them, human beings. Is because of the human beings' action, those one are just delivering the job. They do not like it. Most of the times they do not like what they're doing. But they are forced to do it because of a bad human. And those people, you know, you might go to somebody, I want to inflict harm on this gentleman here. Mm-hmm. The magician doesn't even know the person. And it's not about the money that he gets. No. They are just evil people, enjoy doing evil stuff. There is no solution to them. They cannot repent. You cannot tell them God is great, go back to God. They don't know. They don't want. They do not want. They rather worship Satan and do what Satan says than worship God, the creator of Satan. Mm-hmm. You see, this is how they are. You cannot ask why. Because they are not normal. They are just evil. They enjoy evil. They worship Satan. You see, they can never change.
Yes, someone, I'm sure Mulanango from Limbe, asked whether some men of God can effectively deliver, like you are explaining here.
Well, if they deal with God and God only, without the help of those dark forces, absolutely. Absolutely. You know, you could be cured by the simplest thing. Mm-hmm. So yes, God gives his powers to heal somebody and release the suffering to many different people. To many different people. It doesn't even have to be a man of God to deliver your healing. It doesn't have to be. But as long as this man is connected well to God, then the healing will happen. The healing will take place.
Okay. Please, for those of you who may want to get to doctor and you don't have his number, get to me. I will just write to me. I'll share his number with you. Good evening, sir. Please, I'm watching your TV program right now in which you are talking about spiritual madness. Sir, I have a mother who is suffering from this spiritual madness. Please, sir, how can I get to this doctor? Doctor, can you just give your number again today?
Yes, 694-940172. One more time, 694-940172. Yes.
Okay, but I will send you Dr. Soliman's number. Let me get a few persons who have written again. Good evening, this is Alphonse from Quen. I really enjoyed the lessons from the doctor. Just wish to be seeing things like this regularly. Yes, we hope he's going to be there. Good evening, sir. Please, I would like the doctor to give us his number once more. I'm Ryan Smith talking from Boya. Okay, Ryan, please. Most of you who want doctor's number, can you write me on WhatsApp? I'll send his number. No. Now, doctor, when somebody is delivered, you say in the process you are killing the entities that are living in the person.
Yes, that's exorcism. Okay. We take those evil entities out. Mm-hmm. The person is now clean. Next step is to shield the person, like before the situation has happened to him. Mm-hmm. We place the shield back on him so he is protected, so nothing else happened to him. You see, it's a process, it's steps. First, we clear the guardians that are guarding this, magic. Then we clear the magic. Then we protect the patient by placing the shield back around the patient. Now, I can imagine some of you already asking, but what happens if I renew the magic? Which it happens all the times. You finish with one, you fix the patient is fine, and then the magician will know what you're doing, and he will renew the process. Yes. So usually when we do such a thing, we don't take risk, and we don't leave, we don't leave anything behind. Let me say something, Mr. Leo. When you deal with the devil, when I snatch him, the patient is no longer his target anymore. Who's the target now? Me. So I make sure that in that one session, I don't leave nothing behind, because I know I'm not going to be able to sleep at night if I leave something behind. Or if I do, I cannot do half work. It has to be complete. You accept the light, you go. You don't accept, I kill you. End of story. I cannot make a deal with you. Oh, kill me, Akawa. That doesn't work with me. You leave the patient alone, you go safely. If you illuminate, if you don't illuminate, I kill you. End of story. Now, whoever is responsible of doing this, if they renew the magic, God gives us the power to bring their soul and neutralize them. They will no longer be able to do to this patient or to any other patient. End of a story. You don't have to know who did it to you, as long as it's not going to happen again. That is the main thing. So most of the times, if it repeats, then the doer has to be neutralized. And I'm not saying neutralize, we're going to go and kill him. It doesn't work like that. Neutralize meaning taking all his powers away by God. He no longer can hurt anyone for his remains of his life. That's it. The only chance he got is to repent and go back to God. Or he will get killed by the same entities he had employed.
Okay.
So meaning, if I do magic on you, and you suffer a skin problem now because of this, he will get the same skin problem 4 times the strength. And this is what God has mentioned. It will return back to you 4 times the power.
Okay. Good evening. Greetings, Mr. Leo. Please, I would like to have doctor's number. Roland is writing from Bamenda. Yes, I'll send you doctor's number there. Hello, good evening. Glad to read from you and watch this program. Thank you. Good evening, my media prime. Dennis Taylor writing from Manju. Please, doctor, can bipolar disorder be cured?
Yes, that's a very good question. Thank you very much. What is a bipolar disorder? Bi mean 2. Polar mean both spectrum. Meaning, sometimes I'm very manic. That's mania. I'm very hyper, very manic, hypersexuality. I stay up all night. I buy everything online. I'm going nuts. I don't sleep. I knock on my neighbor's door. I don't sleep. My whole neighborhood is disturbed because of me. That's mania. Second day, I do not even move. That's why we call it bipolar. So we have the major depression accompanied by much mania. Now, the disease has different, let's say, recognition by different doctors. Some will call it schizophrenia with element of depression. That's one diagnosis. That is very much equal to bipolar, which is extreme mania, and the next day turn into major depression. The patient doesn't even talk, doesn't move, doesn't eat, doesn't do anything. So that is bipolar. I had a patient that I'm treating in Turkey, online, with the same thing. After 2 sessions online, the patient doesn't even need medication anymore. It was all spiritual. We had a video for this lady, and in this video I wanted to explain to the audience out there, how would you know some patient is really bipolar because of chemical imbalance or because it's spiritually induced? I had a diagram that you see. I don't know if we can play that video with the hands, or maybe I can do the diagram here. You know, it's like 6 angles diagram with another 6-angle diagram overlapping each other. If the patient can draw the diagram, then the patient is spiritually induced neuropsychiatric disorder. If the patient cannot redraw the diagram that I show, then the patient is mentally, neurotransmitters deficiency, especially dopamine, is deficient, and he has to be on medication. So we have ways to tell whether this is a really true mental disease versus spiritually induced mental disease. There are ways to tell. There are ways to differentiate both categories.
Is that what you're talking about?
I think so. Yeah, I think so. I want you to look at her diagram because I don't see from here. Look at the diagram. See this diagram here? And I ask her to copy the diagram. And look at her. She was diagnosed in Istanbul, Turkey, as bipolar patient. Okay. Now, people know me there, and her husband contacted me, and we did a session online, and the patient, after 2 sessions, as if nothing ever happened. You see, she is drawing the 12-angle diagram perfect. That means this lady is not bipolar. Mm-hmm. So she was eating lithium, and she was eating and I think olanzapine, very big medication, that you have to take the blood level every 24 hours to make sure it's not get to toxicity because it can kill the kidney. And she wasn't even bipolar. She was spiritually induced. We did a couple of sessions, and the lady is fine.
Yeah, but how do you handle such cases for persons who are out of Cameroon?
Online.
Spiritually.
Video conference.
Okay.
Video conference. The whole thing is we snatch what she got, mm-hmm. and then she followed the procedure and she's fine. You understand? See, you can see she drew the diagram perfectly fine. Okay. So, and also I chosen this video to share with the audience to tell you, you know, this spiritually induced problems is not limited to a specific color. That's the white lady there, European. Huh? So European can have it, American can have it, Japanese can have it, Chinese can have it, black can have it, white can have it, green can have it, everybody can have it. As long as you are the target and the victim of somebody with evil mind.
Okay.
Can happen.
I'll take some few messages. Good evening, Mr. Liu. Thanks for this program of today. I'm Solange in Limbe. Please, can I have the doctor's number? Good evening, sir. Please, how can I meet the doctor? Good evening, sir. I'm Mohammed from Yaoundé. How can I get doctor's number? I need Dr. Soliman's number, please. Okay. Good evening, Mr. Liu. Please ask Dr. Soliman. I have my brother who behaves like a madman. He takes too much drugs. Can he be of help? Mr. Linde is writing from Limbe. Please, can you just get to doctor? I've sent you his number. Good evening, Mr. Kum. I need the doctor's number. Oops.
Yeah, I see my phone ringing. I will get to everybody who have called me.
After the program?
Yeah, I will be too late. I will be very tired. So
okay,
tomorrow.
So tomorrow?
Tomorrow.
Okay, kindly send me doctor's number, spiritual madness, okay? Can you just, preferably they should write on WhatsApp,
Yeah.
Okay. Hello, Mr. Leo. Good evening. Please, where is the doctor's location? Doctor is in Boya and in Douala. Good evening, David from Boya. I want doctor's number. Now, doctor, when you engage in this, you say you have to you protect the patient.
Yes.
From further attacks.
Yes.
How do you protect them?
Excellent. See, it's just like if somebody has an infection. Mm-hmm. You cannot, like, I'm going to give you a real life example. This girl that you have seen in the videos, she went to somebody and they put fire shield around her. But the problem they made is they put fire shields around her so nobody can attack her anymore, but with those entities inside. So they were driving her crazy because they have shielded her with fire so nothing else can enter, but with the entities inside of her body. So once we put off the fire, we catch them, we release them, not release them, we either you kill or you eliminate. Then her body was all okay. So now we have to clean all her body. All her system has to be clean. No magic is in her system. And then after we see in her body that she is all clean, then we put the shields back.
How do you put a shield? That's my question.
That is, we just ask for light. And we have the intention that this lady should have light. We'll have the light in our hand and we'll put the light around her spiritually. And if you take her to somebody else who can see, she will, oh, this lady has a lot of lights around her. Now, the light should stick. And if the light does not stick, that means there is a problem with witchcraft.
Okay.
Everybody should have the light around them, especially babies. Babies are protected by God, by those shields that God implement around us, all of us. And it's only human evil mind that can use those entities to disrupt the shield. Once the shield is disrupted, your spirit will suffer.
Good evening, my media prime. My name is Olivia from Sancho. I believe that one can be arrested by the Holy Spirit and begin to do miracles. Please, I need his number. Can I have the contact? Okay. Good evening, Mr. Leo. Please, can the doctor enlighten us more on basic psychological disorders, especially those common with HIV patients that psychosocial counselors can easily identify? Peter is writing from Limbe. Hello, good evening. Please, for the doctor's number, please ask him if he can cure motor neuron disease. Can you do that?
No. He has obviously motor neuron disease. Motor neuron disease is either upper motor neuron, which is in the brain, or lower motor neuron, which goes, motor neuron meaning nerves. Nerves that, motor meaning movement, right? Motor neuron, that means the nerve responsible for the movement. If we have degenerative disease that kill the lower motor neuron, there is nothing, the nerves cannot regenerate. So that's a medical condition, and we have degenerative nerves. The nerves has died off. The nerves that drive the muscles to contract have died off. Nothing can replace that. There is very expensive injection that available in Europe and is experimental that some people use and it works for them, but eventually it doesn't go. And if it's the upper motor neuron, that's a bigger problem because again, neuron mean a nerve cell. A nerve cell do not regenerate. Once it dies off completely, and there is no, I feel sorry for you out there if you have a lower or upper motor neuron. There is medication to, delay the progression of the disease, but up till today, there is no solid treatment that I can say, yes, I can treat you, for the fact that nerves do not regenerate.
Okay. Good evening, Mr. Leo. Thanks for the wonderful program. Good evening, sir. I'm Jeba Wilfred Jebu. I'm watching your interesting program from Ebang Yaoundé. I wish to ask Doctor if he has ever had any spiritual encounter with these magicians. And please, can he differentiate between magicians and witches or wizards? Thank you. Thanks for the lecture, Doctor. Are all mental disorders spiritual, or some could be treated medically? How can any of the above be identified? You said you kill the entities. Can a spirit be killed? Fossey is writing from Kumba. Please, can I have Dr. Soliman's number? Yes, Doctor, can you respond to those questions?
Yes. How can I differentiate between black magician and witchcraft? I really have no interest. How would it help you to know this was a magician or this one is a witchcraft? As long as both inflicting harm and
both are
harm.
Evil.
Both are evil. They both definitely not dealing with God or God lights or God powers. They dealing with dark forces to reflect injury and harm on other human beings. So I really don't care which one makes this one a witchcraft or which one makes this one a magician. If you deal with dark forces and they come my way, with the power of God, I eliminate you in 5 seconds flat, inshallah. That's all. So and that is the first thing, because I have a personal encounter with magician, like used to answer your question, yes, with my own child. I have seen what no man had seen. I mean, my experience was horrible. 8 months, I don't know what's going on. 8 months, can you imagine? 8 months, I believe it's medical, and it wasn't. So yes, I have a personal vendetta with magicians or witchcraft. if they come my way, I'll get rid of you. I'm not talking about now, get rid of you, meaning get rid of your dark forces. So nobody can translate this differently. Meaning you inflict harm on somebody, your harm will be returned back to you fourfold. That's it. And this is what God has promised. I'm not saying nothing from my head. This is what God has promised. You inflict harm on a human being unfairly, it will return back to you. So you can taste what you have done. This is what God said in the Quran. You understand? Yes.
Okay, that is what God has said in the Quran. But you say you kill these guys? You kill the entities?
Yes.
How do you kill? Are they not spiritual? How do you kill them?
Like I told you, Mr. Leo, if I say fire, if I say a verse that contains the word fire, what I say with my mouth is reality to them. So they will really be in fire. If I take a sword and I say kill them, they will be killed. Because what I say to me, to this word, is words. To them is reality. Mm-hmm. That is how. So you can imagine now, yeah. If only you have the eyes to see, then you realize what's going on.
Please, for doctor's number, good evening, please. I'm writing from Bojongo. My name is Daniel. Good evening to you, Daniel. You have it. Good evening, Miss My Media Prime. Thank you for the interesting program. Please tell everyone asking for doctor's number that it is on the screen. Okay. Yes, that is Dr. Soliman's number for those of you.
That's an easy way. We didn't even think about it.
Yes. Okay, Dr. Soliman's number is on the screen. Thank you, Eli, for that. The number is there. Good evening, Mr. Leo. Thanks for the program. I love it. Okay. Thank you, too, for watching the program. Good evening, Mr. Leo. Please, can the doctor enlighten us more on basic psychological disorders, especially those common with HIV patients?
Yes, yes. Okay.
Yes.
We'll elaborate on that.
Good evening, Mr. Leo. Please, I need doctor's number. Clifford is writing from Kumba. His number is on the screen. The second number, the first one is my number. The second one is doctor's number. Good evening, Mr. Leo. It's Renex speaking from the Southwest. If you are feeling like the devil is following me, can he answer? Hello, Mr. Leo, speaking from the Southwest. Feeling like the devil is following you. You have a feeling that there's...
Yes, it is true. It's a true feeling. Mm-hmm. And most likely there is somebody who's following them. Mm-hmm. They feel it when, I have stories and I've seen things, doors open and close, light boom by itself. Mm-hmm. Sometimes you open a closet, you find fire in the clothes. They see that, but is it really there? It is not.
It's not there?
It's not there. They see it with their own eyes. Mm-hmm. You can swear they even can have injuries if they touch the fire. Their skin get burns and the smell as barbecue. But in reality, if you go there, you don't see. If you go there yourself, you don't see. But yet you see physical marks and physical and trauma and everything on their skin as if they really got burned. So it is real.
Good evening, Mr. Leo. I have my daughter that is suffering from seizure for more than 80 years. Can it be treated? Marvis is writing from Bomenda.
Yes, yes. Well, I can answer that very clearly. See, we'll talk about a couple of minutes about seizures, okay? Because that was my situation, 2016, 17. When your daughter get the attack, I want you to look in her eyes and tell me if the eyes are open or closed. So if you make a video clip of your daughter, I want you to focus on the eye. Very important for me to know, eyes open or closed, how long does the attack takes, and how she manifests. She tremors one hand, both hands, all her body, all those are essential. And if you have done an EEG, I want to see the results. Now, when we talk about seizures, or in other words, epilepsy, there is true epilepsy, organic epilepsy, and there is psychogenic epilepsy, meaning psychogenic, meaning the brain make you as you are tremoring. It's all induced from the brain. There is nothing wrong with you. I do MRI is normal, I do CT scan is normal, I do EEG is normal, yet you are tremoring. So this is what we call psychogenic. And in most of these cases, the eyes will be open. If the eyes are closed and it lasts a minute or two, and foams coming out of the mouth and biting the tongue, those are all true epilepsy now. If it only comes at night and wakes the patient up from night, or the patient twitching at night while they sleep, that is most likely spiritual. So we can easily tell a spiritual attack lasts for hours. I'm going to tell you one small story about a patient. This patient will wake up, twitch at night, scream at night, and the patient is a child, is speaking in an ancient language. I have the videos, an ancient language that is spoken about 3,000-4,000 years ago. How can a 10-year-old child tremor at night as if he or she being attacked and speak in a language that is 3,000 years old? That's a spiritual right there. You see, there are ones that are spiritually induced that can only be treated spiritually, and there are ones that are truly epileptic or psychogenic epileptic. Psychogenic, this is for those who wanted attention. They are seeking attention, so they manifest as if they have tremors and seizures. And there are the true ones. Medicine helps in this case, and so can tell us, is it really true, organic one, or psychogenic, or spiritually? There are 3 kinds of epilepsy now, you know. So we can tell easily which one your child belongs to if you send me the video clips.
Okay, good evening, Mr. Kum. May I have doctor's number? I'm Himru from Yaoundé. Good evening, in the house, please, doctor. How can one do to stop when you sleep and they are pressing you on the bed that you become helpless, and when you get up, you are very tired? Emmanuel is writing from Limbe.
Yeah, Emmanuel, this is an attack. That's
Okay.
a spiritual attack right there. That's a spiritual attack right
Yes,
there.
but how do you do that? You need deliverance? Or
We
you
need
need,
to
you need to be
catch-
you need to be shielded.
You need, ask him if he sees dogs, snakes, you know,
Okay.
animals in his dream, dead people in his dream. This is all an attack, and most likely is induced by somebody who's evil. So that's an attack there. When you feel like they're pressing you, remember God. You know, I'm going to tell you a small story. Yeah? Now that you've seen Dr. Soliman on TV, I have a small child. I don't want to say her name, but she was 12 years old. And she was behaving very mad. She will go with a knife, chase her mother, chase her father. That's a very mad child, obviously. They took her to a clinic or a hospital, and they give her a medication called Haldol. Haldol is a medication for those who are mad because it stops the receptors, it blocks the receptors for dopamine. So obviously, they thought it was a mental case. Obviously, she behaved like mad. So they gave her this dopamine, and the child stopped moving. Now her muscles were all stiff, you know, and she cannot move anymore as a reaction of the medication. The family panicked and no, stop. We rather have her as mad than to have her as stiff like this. We call it dystonic reaction to the medication, because she was never a mental case. She came to me, we did few sessions, and I told her, every time you get the attack, think about Dr. Soliman. And guess what? Every 3 months or so, my phone will ring and I see her name. I know, okay, she's so when she think about Dr. Soliman, the entities know that killing is coming. So they stop and they leave her alone. And that's what works for her very well. So she doesn't have to see me again.
Okay, I'm Jeba Wilfred Njibu. He's from Yaoundé. I wish to ask a doctor if he has ever had any spiritual encounter with these magicians, and please can he? Okay, no, I'm sure you answered that already. Mm-hmm. Doctor is really not too concerned about who is a magician or a witch, because they all perform evil acts.
Correct.
Mm-hmm. To distract, to destroy.
I have nothing against anybody, but you harm somebody, we'll just clean the person and return the favor to you. That's all.
Good evening, sir. Thanks for this wonderful program. I'm enjoying it. It's so interesting. Name Desmotin Egbe, writing from Tico. Now, doctor, in cases like this, you are seeing or you feel what is around us.
Yes.
You also, your wife can see clearly.
Very clear.
Yes, but can your wife see the future, or they can only see the past?
To be perfectly clear, we only deal with patients, true victims of evil act. I'm going to give a small example. One day I got a big guy, as big as the door, very big man, young man. He cannot even walk on his feet. They were carrying him. We do the examination, we do this, we do that, nothing. Everything is normal. So I said, let me check you spiritually. And he does have a lot of problems, and it was all spiritually induced. During the captage, during the catching, we see that he was victimizing a lot of people. Then we ask him, because when we caught somebody from inside of him, he told us he should not be taking what doesn't belong to him. That's all he said. That's all what that entity, the dark entity, said. He should not be taking what doesn't belong to him. So we asked the patient, because he's right there hearing. We asked the patient, what is going on? You have to tell us the truth now. He said, well, I was selling horses to ladies in Florida, in America, white horses. He's in Buya, selling horses to ladies and all people in Florida. Obviously, it was a scam. So he was scamming people left and right out of their money. And that somebody now got very mad because he spent a lot of money on something that he has never gotten. So they bought something on him. Can we treat somebody like that? No, because you're not a victim. You have victimized other people that they want their money back that you have taken from them. You're not a true victim. So we cannot help you. The only condition I can help you is to ask forgiveness from those people who stole your money, and then ask God forgiveness, and then we can help you. It's not like, you know, I eat some people money and I take some people land and they put some harm on me and you come to me for me to clean you up. No, it doesn't work like that. If you are a victim, God will help you, because it's not my work, it's God's work. I'm just a tool that will deliver the healing. That's it. But it's, after all, it's God's healing. So you cannot lie to God. If you are a true victim, we'll help you. But if you're not, then we cannot help you, because you are not a victim. You have victimized other people. And unless you repent and return everything that you have taken from other people unfairly, then you are qualified to seek help.
Okay. Good evening, sir. Frank from Boya. I want to ask about treatment for epilepsy. Good evening, Mr. Leo. Please, for Dr. Soliman's number. So many persons are asking for the number. The numbers are there. Yes, now, you treat them differently, the epilepsy?
Epilepsy, like I have said, epilepsy is 3 categories. It's either true epilepsy that only can be treated with medicine, and psychogenic epilepsy. Those are patients who seek attention. They fake the symptoms. We call it psychogenic epilepsy. Or is spiritually induced epilepsy. Spiritually induced epilepsy, you shout different names. You are like attacked, and it lasts for long, half an hour. There is no epilepsy that can last for half an hour. Epilepsy like 5 minutes maximum. And if it continues like this, we call it status epilepticus, and that can kill you. We have to intervene immediately with a medication IV to subside the symptoms before you stop breathing. So this is a true epilepsy. It's all can be documented and evidenced by MRI or EEG, which is the drawing of the brain. During when I evoke you with like lights or something to your eye or high sound, then I measure the waves and see if it's true epilepsy or not. If you send me the video, I'll be more than happy to tell you which category you belong to, medical or spiritual, or psychogenic.
Okay. Greetings, Mr. Leo. Please ask the doctor if all the entities are being placed in someone by humans, or the entities just moving around. Sandrine is writing from Pomède. Bonsoir. Je voulais demander au docteur s'il peut délivrer le village parce que la sorcellerie a fini tout mon village. C'est Amouguzang François depuis Douala. Okay. Hello, sir. I'm writing from Yaoundé. My name is Annabella. I love the program. I have a situation where I only collapse. It has been going on for 2 years today. I even went and saw a psychiatric and was told to try and build myself psychologically. I usually try, but what is in, they can't, okay? What is in, they can't go until I sleep. Can he please throw more light on this? Because recently I was told it's gastric. I've done many results and they tests, they say I'm normal.
Well, if she done all the medical tests, I'm talking about full correct evaluation, and everything is normal, then she fits the category. It's an attack, spiritual attack.
Okay. It's a spiritual attack.
If she fits, if she has done everything like she's supposed to, all medical evaluation is normal, and there are small evidence that we see. I mean, it doesn't take long before we know this is spiritual or not. It doesn't take.
Okay, can we take a second look at some of the videos of the sessions that Doctor had recently in Boya?
فاجعلنا وباء منثورا 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 فاجعلنا وباء. Look at the light. الله نور السماوات والارض الله نور السماوات والارض الله نور السماوات والارض الله ولي الذين امنوا يخرجوا من الظلمات الى النور 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 يخرجهم من الظلمات الى النور نور على نور نور على نور الله نور السماوات والارض الله نور السماوات افحسبتم انما خلقناكم عبثا افحسبتم انما خلقناكم عبثا وانكم الينا لا ترجعون افحسبتم انما خلقناكم عبثا وانكم الينا لا ترجعون افحسبتم انما خلقناكم عبثا وانكم الينا لا ترجعون فتعالى الله الملك الحق فتعالى الله الملك الحق فتعالى الله فتعالى الله فتعالى الله اعوذ بالله من الشيطان الرجيم لو انزلنا هذا القران على جبل لرايته خاشعا متصدعا من خشيه الله لو انزلنا هذا القران على جبل لرايته خاشعا متصدعا خاشعا متصدعا خاشعا متصدعا من خشيه الله خاشعا متصدعا من خشيه الله قل ان صلاتي ونسكي ومحياي ومماتي لله رب العالمين وبذلك امرت وانا اول المسلمين وانا اول المسلمين وانا اول المسلمين وبذلك امرت وانا اول المسلمين وانا. Okay, you did good. You want to go home? You want to go? You did good. Thank you very much. You did good. Now I'm going to release you, okay? You're released. You're free to go. سلام قولا من رب الرحيم. سلام قولا من رب الرحيم. سلام قولا من رب الرحيم. I don't need you anymore. I'm done now. You're good. You okay? You okay? You can go. You want to go? You want to go? You want to go? Okay. You want to tell me more about this girl? What can you tell me? أعوذ بالله السميع العليم من الشيطان الرجيم. I'm going to open your eyes. فكشفنا عنك غطاءك فبصرك اليوم حديد. فكشفنا عنك غطاءك فبصرك اليوم حديد. فكشفنا عنك غطاءك فبصرك اليوم حديد. There is magic, right? Too much magic? Huh?
Okay. I wanted you to explain what was going on. Yes, you are talking. I hear you talking, and yes. Do you understand? Yeah.
Yes. Let me explain. Yes, that's a very good. So this is in this video here we snatch the chief, the biggest one.
Okay.
In this video, we snatch the biggest one. There are so many others. There's small ones there, but we snatch the biggest one, and we offered him the light, and he accepted the light, and now. I asked him, I need a favor from you. He said, why would I do it? I said, because I asked you to do it. So his mission now is to tell me what there is magic, and he told me there is a lot of magic in her. That's number one. Number two, now I ask him to remove the magic, but I don't ask him to do anything for me unless he turns into light first. When I see that he's illuminating and he's light, then he's qualified to do the work for me. Then he went inside and he removed most of it, not all, and he got very tired. And I told him, then you can go home. He said, he pointed to the girl and he said, this is my home. I said, she is no longer your home. You go outside. I see you tomorrow here. You're dead. Now you illuminate. You're free to go. And this is one of the cases that we let them go. Only because they have illuminated, and they also helped us remove some of the magic from that girl. This is how it functioned. I snatched them from her. I put them in the white lady, which is my wife, in her body. Then I deal with them. They accept the light. They clean the lady for me and they go. They don't accept the light, they die. It's as simple as that. This is one session that lasted maybe a couple of minutes. I think maybe 5 minutes maximum. But after the session, I'm exhausted. My wife is exhausted. And the patient is happy. Because we have extracted thousands from her, especially with the chief. The chief now, I cannot, will be very exhausting to kill everybody. So we take the chief. And we tell the chief, okay, take all the weapons you want. We give you all the weapons. Whoever accepts the light can go. Whoever does not accept the light dies. So that chief killed them all for us. And after this, now goodbye. You are free to go, and you can no longer have her as your home. That is what's happening in this.
Yes, so many persons have written to me wanting to know if autism could be spiritually induced and whether it's possible to cure.
Yeah, that's one of the very challenging conditions, autism. And it comes in degrees. There is mild, severe, and moderate. So, to be perfectly honest with you, I have not worked on an autistic child spiritually.
Okay.
I worked on them medically, but spiritually, I have not really. I had to, all those few years that has gone back, I have not done any spiritual session on a child with autism, to be perfectly honest with you. We treat them medically, you know, and psychotherapy and behavior therapy and so on and so forth. But spiritually, it might be. It might be spiritually induced. I cannot answer if I have not seen a patient with the problem and we code for them and we find out spiritual or not. I have not encountered children with autism spiritually. No, I didn't.
Okay, this person keeps calling. We are almost out of time. Good evening, Mr. Liu. I think this program is interesting, but I want to ask, doctor, when you are sleeping and you wake up and see a lot of sperms on your bed, what can I do? Is Lebu talking from Boya?
Yes, Lebo. You can see me in Boya. If you see sperms, you sleep and you see sperm, that's a sexual encounter there with the entity. With this, we call it a spiritual boyfriend, a spiritual girlfriend, a spiritual entity that had sex with you. And the sexual dream is so vivid, it's so real. Whether for men or for women, the sexual dream is very vivid. If it continues and it becomes like almost every day, then you need help. If it happens every once in a while, you do your prayers, you mention God, you believe in God, and it doesn't happen again, then it's nothing to be bothered yourself about. But if it continues and it becomes repeating every day, that's a concern. That I would recommend that you come and see me, since you're already in Boya. I'm in Boya too.
Okay. Many of you are writing to ask for doctor's number. His numbers are there. My number is also there. Write on request for it. We have to end at this juncture. Thank you very much for watching. Thank you also, doctor, for coming to explain these things, especially about witchcraft, something you never believed in.
I never believed in, honestly.
But because of the situation of your daughter.
And for years, you know, it's which I said, I don't believe in it. I cannot see it. I cannot sense it. It's not there. I don't believe it. So till it happened to me. Then what a turn from disbelief to...
Yeah, because it's difficult for a typical scientist, you are a medical doctor.
Rely on evidence-based. But this is something that has hit me in my own children, seen it with my own eyes, lived every moment of it. So yes, I do believe it, 100%. You don't see God, but we believe in God. You don't see the waves that in your phone, yet you talk in the phone, but you don't see how you talk. It's there. If you don't see it, it doesn't mean it doesn't exist. Some people prefer to deny their existence, to put their mind at peace. I'm not going to think about it, they don't exist. But the reality of it, if you do not deny, if you deny it, it doesn't mean they don't exist. They are there.
Okay.
They are around us.
Thank you very much, Doctor, for coming. And also to all of you who took time off to watch this edition of the program. I understand many persons are suffering and are requesting to get to Doctor. His numbers have been displayed throughout the program. Thank you to you, Desmond and Eli, for producing this particular program across the week. We also want to say thank you to you, Tabit and Bryant, for supervising the work we do out here. Stop calling. We are glad to have sailed through this week. Thanks to the special grace of God, we want to say we are grateful. It's not by our power, it's not by our might. It has taken the grace of God to take us through this week. Stay blessed. Bye-bye.